Hello, good morning, everyone. My name is Torsten Schwede. I'm the Vice President of University of Basel and the Group Leader of the Swiss Institute of Bioinformatics. And it's my great pleasure welcoming you here today for our workshop, Share Without Sharing. And specifically, we'll talk about health data, distributed computing, privacy, and trust. And I was digging a bit back in my past. I've been working for some years on the Swiss Personalized Health Network, and this is one of the slides I always used in the past to motivate, like, why are we doing this? And we all have this idea on how is life science, how is medicine going to look in the future, and everything is digital and connected and data-driven and evidence-based, and we make the world a better place. And this is, of course, driven by a revolution in the way how we capture health data, not only in a clinical setting, but also for each of us privately. Every one of us is wearing one of these tracking things, and we monitor ourselves. And I think in the meantime, if I look at it from a VP research perspective, human has become a much better characterized model organism than our rat and mice in the lab. So what are we doing with this data? Well, there's kind of two sides of my circle here. What we have been doing for the last 100 years or so is translational research, extrapolating lab data from model organisms into the clinic, and we know how this works, and it typically works very well. For my kind of shiny slide before, we should also be able to do the other way around, see what's happening in the real world and bring it back into research. And I think there is where I have at least 20 question marks. They all didn't fit on that slide. And in the past, I had to motivate that statement. And today, I think I don't have to just open the newspaper, look under COVID, and you see that we're a disaster in capturing real-world data and making it available both for policy making and for science. And I'm very happy that we have Marcel Salaté here today with us, who will give the opening keynote specifically on what we learned from COVID-19. I'd like to briefly mention two initiatives that for the University of Basel are important, and this is one of the triggers why we are hosting this workshop today. About 7 years ago, we started discussing, can we change the situation in this country, in Switzerland, with all its different cantons and every canton having different legal system, different health system. And that triggered the creation of a national initiative, the Swiss Personalized Health Network, funded by the Science Ministry and the Health Ministry, with the idea of creating an ecosystem that makes data shareable in terms of technology, in terms of processes, in terms of semantics, in terms of legalities, and have scientific projects that actually share data to generate scientific insights from it. The project is now about in the middle. We've been running for 4 years. There's another 4 years. And for one of the central components for us is creating an IT environment that allows for trusted and secure data processing. The project is called Biometait and managed by the Swiss Institute of Bioinformatics. We think that for some applications, there's no way around than sharing actual data, especially if you want to do exploratory type of research. Now, Basel is a very small place. It's a city canton. We're sitting in the corner of 3 countries, and for us, collaboration is not an option, it's a necessity. We're too small to do anything in isolation, so if you sit in Basel, you have to collaborate with your collaborators inside the country, but also internationally. And as a university, for example, we are part of the OICOR network. That's since 1989 a collaboration between the universities of Basel, Freiburg, Haute-Alsace, Strasbourg, and Karlsruhe, which is now even a legal entity where we try to closely collaborate. And one of the thematic priority areas, besides of sustainability and quantum physics, is on personalized health. And you hear my enthusiasm as a scientist. I also have to share some frustration with you. Every time we kick off a new scientific project, we meet these people that wear a suit and a tie, and then you know the project is basically dead for the next 9 months until you get all the paperwork done. I'm a structural biologist. I come from an open science field where new insights come from open science in about 24-hour rhythm, and here we're talking about 24 months rhythm. So there's some kind of an expectation gap on my side. And very often the discussion burns down to data protection, privacy protection, legalities. But in the last years, we have also seen that this kind of technology can not only be an impediment, they can also become an enabler of science. Just thinking about the work by JP Uber at the EPFL in Lausanne around the Medco project, or the work that Bonnie Berger is doing at the MIT, or Jaap Vilo in Estonia, or what our industry colleagues at Novartis and Roche in IMI are doing when they share pre-competitive ways of analyzing structure-function data. So today's workshop, we wanted to explore, is this type of technologies an impediment, or can we turn it around? Can we make it an enabler of exciting science, like our colleagues in the Netherlands with HealthRI have been proposing for years with the HealthStrain project? So today I'm looking forward to a very exciting program with all of you. It's done very interactively, so you will not hear tons of presentations. I'll stop talking in 10 seconds and hand over to Tony, because this is about you. This is about your contributions, your ideas. And if at the end of the day we all have a better understanding which of these technologies are enablers, which allow us to do new kind of science and getting around some of the administrative hurdles, I think then we have achieved the goal of today. So I'm very much looking forward to inspiring discussions with all of you, and I'll hand over to Tony to lead us through the discussions today.